Hello everyone. So in this video we will be studying about cardiomyopathies, the different types of cardiomyopathies. First we will be studying and comparison between the dilated and the hypertrophic cardiomyopathy. So in the dilated we have TTN gene mutation and it is coding for titin protein. While in the hypertrophic, we have autosomal dominant mutation for the myosin binding protein C and beta myosin heavy chain. Myosin binding protein C and beta myosin heavy chain. Then other causes in the dilated one are alcohol, cocaine, doxorubicin, Coxsackie B virus, Chagas disease, hemochromatosis, sarcoidosis, thyrotoxicosis, wet beriberi, and CAD. So many causes are there in the dilated. Okay, alcohol, cocaine, doxorubicin, infections, then storage diseases, thyroid disease, wet beriberi, and CAD. While in the hypertrophic one, we have the cause as chronic hypertension and Frederick ataxia. Okay, then next we see in the dilated one, systolic dysfunction occurs, and in the hypertrophic, diastolic dysfunction. Then there is eccentric hypertrophy in the dilated, while concentric in the hypertrophic. And in the dilated one, sarcomeres are added in series, while in the hypertrophic one, sarcomeres are added in parallel. So how we will remember? Okay. First, in the dilated one, we see the mnemonic as TSSE, means titin gene mutation, sarcomeres added in series, and systolic dysfunction and eccentric hypertrophy. While in the hypertrophic cardiomyopathy, we have the mnemonic that is MDPC, or we can write it as dilated cardiomyopathy, DCMP. Okay, in the hypertrophic, opposite mnemonic we have got. D stands for D stands for that is diastolic dysfunction. Then C is concentric hypertrophy, and M is myosin binding protein, and P means the fibers are added in parallel. So DCMP and TSSE, that is the mnemonic. Then next we see in the hypertrophic one, myofibrillar disarray and fibrosis occurs. Myofibrillar disarray and fibrosis. Then in the dilated one, we have got S3 regurgitant murmur. Dilated S3 regurgitant murmur and hypertrophic S4 systolic murmur and mitral regurgitation. D comes before the H. So S3 in the dilated and S4 in the hypertrophic. Then dilated or balloon heart on X-ray is seen in the dilated cardiomyopathy. And it is also one variant here in the dilated one is Takotsubo or stress or broken heart syndrome. It is due to sympathetic activation. While in the hypertrophic cardiomyopathy, we have HOCM and it can lead to sudden death. And the most common symptom is dyspnea. Then treatment. Treatment part of dilated consists of sodium restriction, ACE inhibitor and ARBs, beta blockers, diuretics and ICD. A, B and D. ACE inhibitors, ARBs from the A, from the B, beta blockers, from the D, diuretics. Then in the hypertrophic one, beta blockers, non-dihydropyridine calcium channel blockers, that is example verapamil, amiodarone, and surgical myomectomy can be done. But diuretics are avoided. Diuretics, that is in the hypertrophic, we do not use diuretics. Diuretics can be used in D for diuretics, D for dilated cardiomyopathy. Then we have restrictive and infiltrative. The third variety of cardiomyopathy is restrictive or infiltrative. It is seen in post-radiation fibrosis, in the Loeffler endocarditis, in the sarcoidosis, amyloidosis, hemochromatosis. All the infiltrative conditions, sarcoid, amyloid, hemochromatosis, and post-radiation fibrosis. Then now we see a table of differences between the three types. Okay, in the dilated one, See, first we will be seeing the LV diastolic dimension. Means how much is the dimension of the left ventricle. Normally it is less than 55. In the dilated one, the ventricle will be dilated. So the diastolic dimension will be more. Then in the hypertrophic, often decreased, and in the restrictive also it is decreased, less than 60. Then atrial size. Atrial size is increased in the dilated cardiomyopathy, increased in the hypertrophic and restrictive. Atrial size is increased in all the three, while ventricular dimension is increased in dilated cardiomyopathy. Then LV wall thickness. LV wall thickness, what we need to remember, it is markedly increased in hypertrophic cardiomyopathy. Okay, and it is decreased in dilated and normal to increased in the restrictive type. Then ejection fraction. Ejection fraction depends on the systolic dysfunction. So systolic dysfunction was occurring in the dilated one. So in the dilated it will be less than 30, while in hypertrophic it will be normal or more than 60%. And in the restrictive one it is more than 30 to 50. So ejection fraction will be markedly reduced in the dilated one, and the size, LV size, will be increased in the dilated one, while in hypertrophic we have LV wall thickness increased. And the symptoms which we see in hypertrophic are chest pain, and in the, that is dyspnea in the HOCM, and in the restrictive one we will have fluid retention. Fluid retention should be there, restriction is mentioned. So that is all about the cardiomyopathies which we need to remember for exams. I hope you will find it useful. If you like my content, please do share and subscribe my channel. Thank you.